So I'd like to welcome everyone to the Vasculitis Foundation webinar today.
Good evening, everyone, and thank you so much for having me here today. So we are going to discuss about brain and vasculitis. I have divided this talk broadly into two parts. In the first part, we are going to talk about systemic vasculitis, how brain can be involved in systemic vasculitis, what are the mimics of vasculitis of the brain. And in the second part, we are going to talk about primary angiitis of the central nervous system, or primary CNS vasculitis, which is a single organ vasculitis. So let's go over some basics. So what is systemic vasculitis? As many of you are aware, it's a group of disorders characterized by inflammation in the wall of blood vessels. And traditionally, systemic vasculitis is classified based on the size of the predominant type of blood vessel that is involved into large, medium, and small vessel vasculitis. Large vessel vasculitis examples are Takayasu's arteritis, giant cell arteritis. Medium vessel vasculitis example is polyarteritis nodosa, which is a rare type of vasculitis. And then ANCA-associated vasculitis belongs to the category of small vessel vasculitis. So as the name suggests, there is multi-organ involvement in systemic vasculitis. For example, in ANCA-associated vasculitis such as GPA, MPA, and EGP, as many of you are aware, these small blood vessels are located everywhere in the body, and it can affect multiple organ systems as shown in this schematic diagram, like the nose, the sinuses, airways, lungs, kidneys, skin, joints, etc. Similarly, in large vessel vasculitis, such as Takayasu's arteritis or giant cell arteritis, as the name suggests, it affects the large blood vessels, like the aorta. Can you see my arrow?
Yes.
Yeah. Great, thank you. Like large blood vessel, the aorta coming out of the heart, and the main branches coming out of it, supplying the upper extremities of the arms, and these big blood vessels coming down to your legs. So any of these blood vessels can be affected by inflammation in large vessel vasculitis and results in systemic symptoms. On the other hand, as the name suggests, single organ vasculitis means the type of vasculitis which is confined to one organ system. The commonest example is skin vasculitis or leukocytoclastic vasculitis or LCV of the skin. Many of you probably know this. So there are skin lesions, which we commonly call purpuric lesions, petechial lesions, and this affects only the skin. Similarly, the primary CNS vasculitis or primary angiitis of the CNS is also a type of single organ vasculitis. It's very rare, and we're going to talk about it in the second part. All right. So how often do you worry about brain involvement due to vasculitis? Not at all, rarely, frequently, all the time. You can put your answers in the chat box. I'll wait for a few seconds.
Oh, there's a lot of answers coming in.
Yeah, that's pouring in. And you can keep, and then the second question I wanted to ask you, which of the following symptoms have you experienced that worries you about brain involvement? Headache, memory problems, confusion, speech problems, vision changes. There could be more than one answer to it. I'm just opening it. All of the above, all of them, headache, memory, confusion, yeah. Most of them, yes, a lot of. Somebody said I cannot see a presentation. Okay, can you see?
Well,
yes. Okay, and then they said yes. Okay, I think it's figured out.
Yes, it's been figured.
Okay, great. Okay, all right. So So I understand that, as expected, this is obviously a big area of concern for all of us. Patients who have vasculitis, us, healthcare providers who take care of patients with vasculitis. So let me start by saying that it's rare. Brain involvement is very rare in systemic vasculitis. It's less than 10%, probably even way less than that. And it's almost always associated with active systemic disease. So people who have systemic vasculitis, when they have brain involvement, almost always they have evidence of active disease elsewhere in the body. So that's a clue. And we will talk now a little bit about how the brain can be involved in systemic vasculitis. So as elsewhere in the body, in systemic vasculitis, there can be inflammation in the arteries which are supplying blood to the brain. This is a schematic representation of the blood supply to the brain. As you can see in the lower part, you can see a little bit of the aorta. That's the big blood vessel coming out of the heart, and it gives out branches, the subclavian arteries, and the carotid arteries, which then goes up, divides into multiple branches, supplies various parts of the head and neck and the brain. There's vertebral arteries, which comes out of these subclavians, again goes up and supplies various parts of the head and neck and the brain. Now, any of these arteries can be affected by inflammation. So what happens when there's inflammation to the blood vessels? So in this diagram, in the top, you can see this is a normal artery. This is the normal arterial wall with a normal lumen. Lumen is the part of the artery through which the blood flows. If there is inflammation, continued inflammation, that can result in thickening of the wall of the arteries, and that results in of the lumen of the artery. And over time, there can be complete loss of the lumen or occlusion of the lumen. And as you can imagine, if these things happen in the brain, in any of the arteries supplying a part of the brain, that part of the brain loses blood supply. So there is ischemia, there is damage to the brain because of decreased blood supply. On the other hand, sometimes due to continued inflammation in the vessel wall becomes thin, and the wall gets dilated, something we called aneurysm, and this is how it looks like. And this weakened wall that becomes prone to rupture, and rupture of the blood vessel results in bleeding into the brain. So direct inflammation in the wall of the blood vessel supplying the brain can result in ischemic damage or bleeding or hemorrhage in the brain. And the symptoms are usually acute onset, as you can imagine, like stroke-like symptoms, resulting in numbness, weakness, depends on which part of the brain is affected, confusion, speech difficulty, vision changes, dizziness, loss of balance, severe headaches, etc. Now, what are the other ways the brain can be affected? There could be inflammation of the brain itself or the meninges or the covering of the brain. This is a schematic diagram showing the brain and the covering or the meninges, and this is a magnified picture of the meninges. The meninges or the covering of the brain consists of multiple layers or multiple membranes. And in between the membranes, there is this fluid called the cerebrospinal fluid, which is very important for the brain. It acts as a protective layer. It provides nutrition to the brain. It also takes away waste from the brain. So there could be inflammation of the meninges, or there could be inflammation in different spots of the brain. And that results in various symptoms such as loss of memory, reduced ability to think clearly or concentrate, confusion, drowsiness, changes in personality. These symptoms can come up subacutely. Now we're going to talk about another way by which brain can be involved, which is by cranial nerve inflammation or cranial nerve involvement. There are 12 cranial nerves, cranial nerve 1 through 12, which originate in different parts of the brain as shown in this diagram. And depending on what type of cranial nerve is involved, the symptoms will vary. For example, if there is inflammation of the optic nerve, which is the second cranial nerve, and this nerve we need for vision, there could be vision changes. Then we have separate nerves, cranial nerves 3, 4, and 6, which regulate our eye movement. So inflammation of those nerves causes paralysis of eye muscles. Again, there are other nerves which are important for our hearing, for balance. So when those nerves are affected, it causes dizziness, vertigo, hearing changes. So with this background, as you can imagine, as you can see, the symptoms of brain involvement in systemic vasculitis are very non-specific in terms of severity, in terms of onset, they are variable. Common symptoms are cognitive disorders, mood changes, confusion, difficulty in ambulation, headaches, stroke, seizures, and visual changes. And probably there are some more. So these are the common symptoms. Now, at this point, you're probably thinking this is like so confusing. They're non-specific, they're variable, there are multiple symptoms, depends on how the brain is affected. If it's by stroke, it's acute. If it is by inflammation, maybe subacute. How are we going to figure this out? So there are some, diagnostic ways. And like most of the conditions in rheumatology, the beginning is a good history and a detailed history and clinical examination. Often, in this situation, we need an expert multi-specialty team. We need help from our neurology colleagues, radiology colleagues, and sometimes even neurosurgery colleagues. The investigations which are helpful include blood work, which are not specific, but are helpful, like measures of inflammatory markers in the blood, and few others could give us some clue. Brain imaging is very helpful. Most often than not, we will see some abnormalities in brain imaging, which may not be specific, but gives us a clue. For example, this is brain imaging. I took it from one of a review article. So this is a patient with giant cell arteritis, and the arrows show basically different areas of ischemia. So ischemic damage due to decreased blood supply. This is another abnormal brain imaging where, you can see the meninges or the coating of the brain that looks more white than it should. Basically, that indicates that the meninges are inflamed. We often do lumbar puncture for CSF analysis, cerebrospinal fluid analysis. And how it helps is like it shows us whether there is any evidence of inflammation. We look for the level of protein, cell count, etc., which gives us clue. And then lastly, but not the least, brain biopsy. So that is often very helpful because it shows us what type of inflammation is there, and also not only help us to rule the diagnosis of brain inflammation or brain vasculitis, but also helps us to rule out other mimics, other conditions that may look like vasculitis but are not. And that will make more sense as we go over the next few slides. So let's go over the common mimics. As I started the talk on it, I say that it's very rare. So that's, I would say reassuring that it's a very rare condition having brain involvement. So, but these symptoms of cognitive changes, memory issues, etc., are not uncommon, as many of you responded in the chat box. So we have to think about what are the other causes of these kind of symptoms. So the common mimics of brain vasculitis, we would talk about the medication side effects, metabolic derangements, and infections today. So medication side effects, any drug can cause cognitive impairment in susceptible individuals. And the susceptible individuals are usually, people who are older, polypharmacy, which unfortunately are many of us, because we do give people with vasculitis a lot of medications, including immunosuppressions. We give medications to protect bones, to as a prophylaxis against infections, etc. So polypharmacy is another factor. This talk obviously would be incomplete if I don't talk about the side effects from prednisone, which can cause symptoms such as cognitive issues, emotional lability, psychosis, confusions, which can look like brain involvement from the vasculitis. These symptoms are usually dependent on the dose and the duration of treatment with glucocorticoids, and then disorientation. Other medications which can cause similar side effects include the medicines which are used for insomnia, for pain, for anxiety. So what are the strategies to minimize medication-induced side effects? Obviously, the first step is high index of suspicion, and then drug-free trials in suspected cases. Obviously, when you're taking these medications, there's a reason why you're taking these medications, and you cannot just stop any medication on your own. So this is something to discuss with your healthcare provider, go over the dose, duration, if you can reduce some of the medications, are there any concerns for drug interactions, etc. And if possible, some drug-free trials may be helpful. Careful monitoring of drug therapy is important. Then the other common cause which can mimic brain vasculitis are metabolic derangements, such as blood glucose abnormalities. Very high or very low blood glucose can cause cognitive changes. Abnormal levels of electrolytes such as sodium, potassium, calcium, and there could be various causes for these abnormal levels, including some medications can cause that, dehydration, etc. So it's important that when somebody is going through these symptoms of sudden change in cognition, memory issues, etc., checking the basic blood work, making sure we are not missing any of these mimics. The other thing, is the abnormal thyroid function, hypothyroidism, hyperthyroidism. These are common problems in the general population as well as in our patients with vasculitis. And therefore, it's important to make sure that we are not missing any thyroid dysfunction contributing to mental changes. And then we are going to talk about infections. There could be infections of the brain or the meninges, like meningitis, encephalitis, or severe systemic infections can also cause cognitive changes. Our patients, as we are all aware, are treated with immunosuppressive medications and are at a higher risk of infection. So therefore, it's very important to rule out infections before we determine brain involvement from vasculitis. Common symptoms, as you can see, are very similar to brain vasculitis, such as headache, confusion, fever, and depending on what organ system affected, there could be other systemic signs of infection. So how do we determine that? This is where the investigations, of course, detailed history physical is very important, or the first step, and other investigations here are very helpful. Laboratory tests, including cultures like blood cultures, urine cultures, sputum cultures, depending on the type of infection or symptoms, swabs, then cerebrospinal fluid analysis, which we discussed at the time when we discussed about the investigation for brain vasculitis. We can check the CSF for evidence of inflammation. We can also test CSF for evidence of a brain infection. Then imaging is helpful. There are some imaging clues which may be helpful to differentiate between infection versus inflammation. And then finally, biopsy. In very difficult situations or, diagnostically difficult, the biopsy can be tested for cultures infections, etc., to differentiate between inflammation from vasculitis versus infection. So how to address the symptoms concerning for brain involvement? Obviously, the first step is if you are experiencing a new symptom, a change in your symptoms which are concerning for central nervous system involvement, the first step would be to contact your care team. Again, depending on the severity or the acuity of symptoms, either you contact your physician for a routine discussion versus do you need to go to the emergency room. So onset and severity, those will determine the next steps. First step would be to discuss the medication list, consider the comorbid medical conditions, the common situations such as blood glucose level, such as the thyroid function level, whether all the electrolytes are okay, etc. And then review the lab test results, which gives us some basic clue. And then after all the common conditions have been ruled out in appropriate clinical scenario, the tests that help us include brain imaging, analysis of the cerebrospinal fluid, and then finally biopsy. All right, so now we're going to moving on to the second part of the talk, which is on primary CNS vasculitis, which is a single organ vasculitis affecting the central nervous system without involvement of other organ systems. It's very rare. Average annual incidence rate is 2.4 cases per million. The common clinical manifestations are headache, dementia, cognitive dysfunction, behavioral and personality changes, and usually these symptoms come up insidiously, slowly. Usually they do not come up very acutely. Some patients, up to 50% of the patients, have history of recurrent multiple strokes. Rarely there can be cranial nerve involvement, seizures, coma. So diagnosis it's challenging and it's a team effort. It's important that there is an expert multi-specialty team, including rheumatology, neurology, radiology, and sometimes neurosurgery. We always think about the mimics or the alternate diagnosis. Make sure we are not missing common things such as a brain infection before giving somebody a diagnosis of brain vasculitis or primary CNS vasculitis. The tests which are again helpful include the CSF examination, brain imaging, and cerebral angiography. And this is a picture of cerebral angiogram of a patient who had CNS vasculitis. The black arrows shows the areas of stenosis or narrowing of the blood vessels. And then finally, brain biopsy are helpful. So I just wanted to let you know that at the University of Pennsylvania, we now have the CNS vasculitis longitudinal study open. It is observational study where we are gathering information, clinical information, and we are collecting biological samples such as blood samples to learn more about this disease. All right, so let's go over the take-home points from today's discussion. Brain involvement in systemic vasculitis overall is very rare. It's less than 10%, and it's almost always associated with severe disease systemically. Common mimics are medication side effects, metabolic derangements, and infections. And then we talked about CNS vasculitis, which is a single organ vasculitis and is extremely rare. Thank you.